In your work on MERS, what were the most memorable high points?
MERS-CoV has been first diagnosed in my country in 2012. And since then we had continued to see cases on a regular basis. Most of the cases were related to major outbreaks of healthcare-acquired infections. But in the background, we also have a community-acquired cases that are directly linked to camels, which is the primary source of human infection. So MERS-CoV is a zoonotic disease that is directly transmitted from camels to humans or indirectly through the environment. We have seen significant changes in the epidemiology of MERS-CoV. This was fueled by the accumulating experience and knowledge of how the virus is transmitted from animals to humans and also between humans. The major advantages or the major advances that we had in our understanding was the infection control application in relation to MERS-CoV. The outbreaks that took place in 2013 and 2014 were huge outbreaks that affected hundreds of people, either patients or healthcare workers. That was a call for us in the Kingdom of Saudi Arabia and also in the world to understand more the transmission and the dynamics of the disease. A significant improvement took place in the infection control aspects of MERS-CoV that had resulted in a dramatic reduction of healthcare-acquired infection. We were able to control outbreaks. We did not have any significant outbreak in 2018, for example. Most of the outbreaks were detected early and were controlled. We have a continuous presence of MERS-CoV in the community because most of the camels in the Arabian Peninsula and also in the surrounding region are infected with MERS-CoV, and they continue to spill over the infection to human. So the public health intervention now are approaching this method of transmission by educating people on how to prevent the transmission of infection from camels to human, how to use the common sense and the simple preventive measures like observing hand hygiene, trying not to contaminate the environment and their clothes, try not to get in touch with direct contact with camels, even if they do not have symptoms. What we are doing at healthcare facilities is that everybody who has respiratory symptoms are considered to be a MERS-CoV suspect, and they are triaged through a specific system that will be able to detect if they are infected or not through direct testing. So we are doing hundreds of thousands of tests every year just to make sure that we are not missing a case. We have difficulties in finding MERS-CoV in certain types of population, like people who have a chronic renal failure and are on hemodialysis, and also people who have heart condition. These kinds of patients will not have the typical symptoms of MERS-CoV, and they might be missed. That's why we are changing or modifying our case definition to be a more sensitive case definition for these kinds of individuals. So in general, there have been significant progress in the way that we understand the dynamics of transmission within healthcare facilities. We are still having significant gaps of knowledge on how the virus is transmitted in the public. What is the role of people who have mild symptoms or have no symptoms, but they are carrying the virus? What is their role in keeping the dynamics of the virus transmission in the community?
How can the Ministry of Health of Saudi Arabia help WHO's regional office set up this pool of MERS experts, given Saudi Arabia's knowledge and experience?
The Kingdom of Saudi Arabia has been the most affected country by MERS-CoV. More than 80% of cases are diagnosed in the Kingdom of Saudi Arabia. This has resulted in a building up of a significant experience in dealing with MERS-CoV. in the field of public health investigation, in the field of animal health investigation, in the field of infection control within healthcare facilities, and also in the laboratory detection of MERS-CoV. So we have built a significant pool of experts nationally at the Kingdom of Saudi Arabia, and I think we will be able to provide a good list of experts that can help build a regional team of experts that can help also countries in dealing with imported MERS-CoV or endogenous MERS-CoV that may happen at any country. In general, I think the experience that the world has generated in dealing with MERS-CoV is significant, but there are still a lot of unanswered questions that, especially in the management of cases and also in the community transmission of MERS-CoV, we need to invest more in the therapeutic interventions of MERS-CoV and also the vaccine development, both in human and in animal side.